nervus is a Latin word for nerve. Neuro is a Greek word for nerve. Literally, neuro actually means a tendon. That's why a flattened tendon is called as aponeurosis. So here we can say that the nerves are like cables, which are cord-like. And that's why it resembles a tendon. That's why neuron. The original word came that way. The basic fundamental unit of the nervous system is called as a neuron. How do you spell? R-O-N or R-O-N-E? The original British spelling is R-O-N-E, neuron. But now we spell it in India as R-O-N. If you look at some British books, it will still be written as R-O-N-E. When you think of the word neuron, what do you think of? You think of a star-shaped structure with a long cord coming from it. This neuron is called as a multipolar neuron because it has got multiple processes called dendrites and a single long process called as axon. But there are other varieties of neurons also. Some neurons do not have any process. This is called as an apolar neuron. No processes. The example is several neurons of the fetal life are apolar. They have not yet acquired the polarity. And in adult human, adrenal medulla cells are apolar neurons. Some of the neurons have only one process. It is called as unipolar neuron. This single process subsequently divided into two branches. One will be carrying the impulses away from the cell body, one will be bringing it towards the cell body. So, people used to formerly call it as pseudo-unipolar because they felt it's not actually unipolar. There are two processes, one taking impulses away and one bringing it towards. But now it has been found out, it's not like the two processes are twisted to each other. It is just a single process which is dividing into two. So, unipolar. Another type of neuron is where there are two processes, they are opposite poles of each other. That is called a bipolar neuron. And then the classical multipolar, where there are multiple small processes which look like a branches of a tree called dendrites and a single long process called axon. Traditionally we think dendrites carry impulses towards the cell body, axon takes impulses away from cell body. This is for multipolar neuron. When it comes to unipolar neuron, the two processes branching out from a single process, both are long. It is incorrect to call it as a dendrite even if it brings impulses towards the cell body, because it's not looking like a branches of a tree. It is looking like a process. It is looking like an axon. So to avoid confusion, we don't use the word dendrite axon. We call it as peripheral process and central process. From the cell body, one process goes to the periphery and other goes to the central nervous system. So peripheral process, central process. This type of neuron is usually present in the sensory pathways. The law that governs migration of neurons is called as neurobiotaxis. The law that governs the migration of neurons is called as neurobiotaxis. There are three rules in neurobiotaxis. Rule 1. Every neuron has an urge to centralize. It means all neurons want to be a part of the central nervous system. And those which are already centralized, the neuron has an urge to encephalize. That means those which are already in the nervous system, they want to go to become a part of the brain, not remain in spinal cord. Encephalize. And those who are already in the brain, encephalon, they want to telencephalize. They want to become a part of telencephalon. Okay? So urge to centralize, encephalize, and telencephalize. Second rule is neurons migrate towards source of stimulus. Neurons migrate towards source of stimulus. And third rule, axons with similar properties, similar function, will lie together. Axons with similar property, similar function, will lie together. So let's now start classifying the nervous system. Anatomically, we classify it as central and peripheral. Central and peripheral. Central nervous system has got a basic plan. There is a cavity in the center, which when enlarged is called as ventricle. This cavity is filled with cerebrospinal fluid. Surrounding the cavity is grey matter. Outside the grey matter lies white matter. Except in cerebrum and cerebellum, there is an additional layer of grey matter outside. Except for cerebrum and cerebellum, I think there is an exception to this rule. What is the rule? Cavity in the center filled with CSF, surrounded by grey, surrounded by white. The exception in cerebrum and cerebellum is that there is an additional layer of grey matter outside, which is called as cortex, cerebral and cerebellar. And because there is a cortical grey, the inner white, the middle layer white, is also called as medulla, because opposite of cortex is medulla. So white matter of cerebrum and cerebellum are also called as medulla. Surrounding the central nervous system, there are three layers of meninges. From inside to outside, pia matter, arachnoid matter and dura matter. How do you spell matter? TT or T? Dura, arachnoid, pia are matter, M-A-T-E-R. Grey matter and white matter are double T. So the matter refers to substance. Here matter refers to maternal. Maternal. So they are protecting the brain. Between the dura and arachnoid, there is fluid called as cerebrospinal fluid. So this is about central nervous system. Peripheral nervous system are branches of central nervous system. Branches which arise from spinal cord are called as spinal nerves. Those that arise from the brain are called as cranial nerves. Spinal nerves emerge between two vertebrae. The space between two vertebrae, what is called as intervertebral foramen. There are 7 cervical vertebrae, but 8 cervical nerves, because the gap between two vertebrae are 6, but there is a space above and there is a space below. 8 cervical nerves. 12 thoracic vertebrae, 12 thoracic nerves, because now we can't count the one above the first thoracic because that has already been counted as C8. So there are 12 thoracic vertebrae, 12 thoracic nerves, 5 lumbar vertebrae, 5 lumbar nerves, 5 5 fused sacral vertebrae, 5 sacral nerves. Four coccygeal vertebrae, but only one coccygeal nerve. Okay? That is because the tail is vestigial, so it's gradually disappearing. The nerves have already disappeared, so there is only one nerve, making a total of 31 pairs of spinal nerves. 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. Let us deal with briefly what do these spinal nerves supply. Which part of the skin they supply, which muscles they supply. The part of the skin which is supplied by a single spinal nerve is called as dermatome. The muscles that a single spinal nerve supplies is called myotome. Dermatome, D-E-R-M-A-T-O-M-E, myotome, M-Y-O-T-O-M-E. C1 nerve does not supply any part of the skin. We describe that as C1 has no dermatome. C2 and 3 supply the neck, skin of the neck. C4 supplies the skin over the shoulder. C5 supplies the lateral part of elbow. C6 supplies the thumb. C7 supplies index finger. C8 supplies little finger. T1 supplies medial part of elbow. T2 supplies axillary skin. Have you noticed certain parts of the upper limb are missing? I did not mention about middle finger, ring finger. So many other parts are missing. That is because there is an overlap of adjacent dermatome. So whatever we have mentioned is that part is exclusively supplied by one spinal nerve. So you want to test C6 dermatome, you have to test thumb. Are you getting the point? If you want to test C7 dermatome, test the index finger. Middle and ring finger show overlap between C7 and C8. Little finger is exclusively for C8. After that, T3 onwards, they supply each intercostal space, the spaces between ribs. On the up to T6, they supply up to 6th space. T6 supplies Zephyr. T6 supplies Zephyr. XI.
T6, what do they supply?
Intercostal spaces T3, T4, T5, T6. T6 supplies the Zephyr process of Zephyr. XI, PHI, sir. T7 onwards not only supplies intercostal space, they will also supply anterior abdominal wall. So anterior abdominal wall is segmentally supplied by T7, T8, T9, T10, T11 and even the subcostal nerve T12. Out of that, T10 supplies the umbilical region. L1 supplies the upper part of thigh. L2 upper lateral thigh. L3 lower medial thigh. L4 medial part of leg and medial part of foot. Excluding the great toe. This is about L4. L5 supplies the lateral part of leg and dorsal aspect of foot. Medially, including the great toe. S1 supplies the lateral part of the foot, including the little toe. L5 supplies the lateral part of leg and dorsum of the foot medially, including the great toe. S1 is lateral part of the foot, including the little toe. S2 supplies the back of the leg and thigh. S3, S4, S5, coccygeal. Supply the perianal region. Why is studying this nerve important? If there is damage to isolated spinal nerve, you will understand which part of the skin will get anesthetized. That is not very significant because adjacent nerve roots overlap to a significant extent that they might cover up. What is more important is that if the internal organ, which are also supplied by the spinal nerves, and the internal organ gets inflamed, the initial pain will be projected to that part of the skin supplied by the same spinal nerve. For example, if appendix is supplied by T10, the pain will not be felt initially when the appendix is located. It will be felt at the umbilicus. Are you getting the point? If diaphragm is irritated, the pain will be felt at tip of the shoulder. Diaphragm is so far away, tip of the shoulder is so far away. But because diaphragm is supplied by C4 and tip of the shoulder is also supplied by C4, the brain projects the pain to the dermatome, C4. Such type of projection of pain close or away from the organ that is affected is called as referred pain. So different organs are located in different places. It depends on the nerve which supplies the organ. The pain will be projected to the skin where the organ is, where the same nerve supplies, projected to the skin, referred pain. The next is myoto. C1, C2, C3, C4 supplies muscles of the neck. However, C1 did not have any dermatome, but it has a myoto. C1, C2, C3, C4 is supplying the muscles of the neck. C5 to T1 will supply muscles of upper limb. It's not just sufficient to say that it supplies muscles of upper limb. You need to know more about which muscles of upper limb. Remember, although nerves supply muscles, but the brain knows only actions, movements that you want to perform. So you start keeping the upper limb in a functional position. The functional position of the upper limb is when you are writing on a piece of paper. That's a functional position. From the functional position, movements can be forwards or backwards. Forward movements are performed by upper spinal nerves. Backward movements are performed by lower spinal nerves. Forward movement is performed by upper spinal nerves, backward movement is by the lower spinal nerves. Proximal muscles are supplied by upper spinal nerves, distal muscles are supplied by the lower spinal nerves. So these three things you should know. First you place the upper limb in the functional position as you are writing, and then you speak about forward backward movement and you speak about proximal distal muscles. Now you can understand, when you are writing, the shoulder is already slightly abducted. Further continuation of abduction at shoulder is done by C5. Abduction of shoulder is done by C5. adduction of shoulder, EC6, C7, C8. This is about shoulder. We are not talking about other movements because these are the two common movements, abduction and adduction. Elbow flexion is by C5, C6. Elbow extension is by C7, C8. Notice the spinal segments are the same, but the distribution is slightly different. There it was 5, 6, 7, 8. Here it's 5, 6, 7, 8. Radioulnar supination. From a writing position, you realize supination is forward, pronation is backward. Supination is mainly by C6. Pronation is by C7. So which position is supination? Palm facing upwards, supination. And pronation is downward. So in front of the functional position, supination is a forward movement. That's why C6. Pronation is a backward movement. That's why reversal of that. C7. Wrist joint, again from the functional position of upper limb, forward movement is extension. So extension is C6. Flexion is C7. Don't go from the anatomical position. In anatomical position, forward is flexion, backward is extension. But from the functional position, forward is extension, backward is flexion. So if you notice, wrist and radioulnar have same root value, C6 and C7. But there is no involvement of C5 because as you go distally, lower spinal nerves come into play. Fingers have two types of movements, flexion extension and abduction adduction. Flexion extension both of fingers are done by C8. Flexion extensions of finger are done by C8. Abduction adduction of fingers are done by T1. Why is this so? Flexion extension are done by forearm muscles going to the fingers, whereas abduction adduction are done by muscles in the hand. So as you go distally, it must be the lower segment. So abduction adduction, which are done by intrinsic muscles of the hand, they will be supplied by T1, whereas flexion extension are done by forearm muscles going to the hand, fingers, therefore C8. After that, each intercostal space and anterabdominal wall are segmentally supplied by 1-1 spinal nerve. All the way up to L1.
Are segmentally supplied by
Each spinal nerve 1 at a time will be supplied from T2 to L1. So intercostal space, second space will be supplied by T2, third space will be supplied by T3, like that. So also anterior abdominal wall, same like what we saw in Dermato, T7 to T12 L1 will be supplied by abdominal wall. Dermato was T7 to T12, myotom is also C7 to C12. L2 to S3 supplies lower limb. That is not enough. You have to know specific which movements. So you have to start same on the ways of the rules of upper limb. You start with keeping the lower limb in functional position. Functional position of lower limb is the standing position. The other two rules remain the same. Forward movement by upper spinal nerve, backward movement by lower spinal nerve, proximal muscles by upper spinal nerve, distal muscles by lower spinal nerve. So let's start. Hip flexion. This is the forward movement. L2, L3. Hip extension. L4, L5. Okay, hip flexion for the forward movement L2, L3. Hip extension, backward movement L4, L5. When it comes to the knee joint, forward movement is called extension. So knee extension and knee flexion is a backward movement. Now what was the segments of hip joint? L2, L3, L4, L5. Knee joint L3, L4, L5, S1. So knee extension is L3, L4. Knee flexion is L5, S1. Okay? The next joint is the ankle joint. The forward movement is dorsiflexion. The backward movement is plantar flexion. Again, what was the segments of hip joint? 2, 3, 4, 5. What was the segments of knee joint? 3, 4, 5, S1. What will be the segments for ankle joint? 4, 5, S1, S2. So the dorsiflexion is done by L4, L5. Plantar flexion is done by S1, S2. The first of dorsiflexor also helps in inversion. So inversion is done by L4. Eversion is done by L5S1. Intrinsic muscles of the soul are supplied by S3. all the rules are met with functional movement forward, backward, proximal distance, the problem with lower limb is that except for L4, which is doing the job of inversion, all other activities are done by multiple nerves, two at least. Toe movements are functionally not important. So S3 damage alone will cause paralysis of sole muscles, which is not of very great significance. Because we can hardly abduct or adduct the toes. So only L4 can be tested by myotoe, because inversion will be lost. All others, because of the job done by two spinal segments, if one spinal segment is damaged, you can't detect. So, in lower limb, dermatome is more important, because vast areas of the skin are supplied by a single nerve. So you can easily identify which nerve is damaged based on the area of the skin that they are supposed to supply. Whereas in upper limb, if you notice, there was a lot of, because of the lesser number of segments and more movements, multiple actions are done by different nerves. So there is a lot of overlap between, there is a confusion. The only lack of confusion is abduction of shoulder is by C5. If C5 is damaged, shoulder abduction is lost. Other than that, there are multiple intricate movements which are possible in multiple joints with the same spinal segment. It is difficult to detect exactly which spinal segment is involved, but you can make out if one or two spinal segments consecutively is involved. This is about peripheral spinal nerve. We talked about the skin and the muscles that they supply. Only once one takes the anatomy final viva, great vacations are heavenly. Okay? This mnemonic is for the 12 cranial nerves. Only once one takes the anatomy final viva, great vacations are heavenly. The last four nerves, great vacations are heavenly, are called as neck cranial nerves. The first 8 are the head cranial nerves. Let us briefly deal with what it does. Cranial nerves are numbered 1 to 12 based on Roman numerals, capital Roman numerals. Cranial nerve number 1 is olfactory. Concerned with the sense of smell. concerned with vision. Third, fourth and sixth are concerned with movements of eyeball. And constriction and accommodation of pupils. Constriction and accommodation, not of pupils, constriction of pupils and accommodation. Cranial nerve number 5, trigeminal. Third, fourth, and sixth we didn't give the name. Third is oculomotor. Fourth is trochlear. Sixth is abducens. Fifth is the trigeminal. Supplies the skin of the head and face. Except the skin over the angle of mandible. This is a very prominent exception. Skin over angle of mandible is not supplied by trigeminal. Instead, it is supplied by C2 spinal nerve. It's the only part of the face not supplied by trigeminal. Instead, supplied by C2 spinal nerve. Remember, C1 has no nerve, so it can't supply any skin. Next is C2. And trigeminal also helps in moving the lower jaw for mastication. So muscles of mastication, that is chewing, is supplied by trigeminal nerve. Why is it called trigeminal? What is the star sign Gemini?
Twins.
Gemini means born together. Born together. So if two are born together, we call it as twins. By Gemini. If three are born together, we call it as triplets. Trigemini. Four are born together, likewise quadruplets. Quadrigemini. So trigemini are the nerve immediately after it forms divided into three branches. The first branch is called ophthalmic. Which supplies the forehead, eyeballs, nose up to its tip. When we say eyeball, don't confuse with vision, because vision is done by the second cranial nerve, optic. This ophthalmic will supply the eyeball for the sense of, say if there is a dust entering your eyes and you get the irritation. You can't even see the dust, but you get the irritation. The irritation sense is carried by ophthalmic. The visual part is carried by optic. The second branch of the trigeminal is maxillary, supplies the upper jaw region. The third branch is called mandibular, supplies the lower jaw region. and also helps in movement of mandible. Let me ask you a question. In crocodiles, only the upper jaw moves, one option, or only the lower jaw moves. Third option, both the jaws move. When a crocodile is opening the mouth, only the upper jaw moves, only the lower jaw moves, or both the jaws move.
Upper jaw.
Crocodiles, like other vertebrates, can only move their lower jaw. Only. It gives us an illusion that the upper jaw is moving. What it does is, the rate at which the lower jaw depresses, the same rate it extends the neck. So while it's opening the mouth, so lower jaw remains where it is, upper jaw is moving up because the head is extending. If it did not extend the head, it will gulp only water. If it were to gulp the prey, the lower jaw must be in the level of water, upper jaw must come out of it. So it has to extend the neck. Because EMG studies, electromyographic studies have shown that the maxillary division of trigeminal, even in crocodiles, is only sensory. The mixed nerve is only mandibular because only lower jaw can move. Vertebrates which have jaws cannot move their upper jaw, only the lower jaw. There are vertebrates without jaws, which are jawless vertebrates without the lower jaw. Sharks. Sharks don't have lower jaw. That's why shark does not catch hold of the prey and gulp it down. It moves ahead relative to the prey that it is going to eat. Automatically the prey will be in the body. It does not have a lower jaw. Despite that, there's a movie. It has 1, 2, 3 sequelae jaws dealing with sharks, which does not have a lower jaw at all. But the upper jaw is sufficient enough to cause all that terror it causes. You sit on, huh? You sit on. This is on now. Seventh cranial nerve facial supplies muscles of the face. Besides that, it supplies lacrimal gland, mucous glands of nose, palate, pharynx, submandibular, sublingual glands, and glands of the tongue. Besides these, facial nerve also carries taste sensations from anterior 2/3 of the tongue. In fact, anterior 2/3 of the tongue is the tongue for taste. The posterior 1/3 can do nothing much. It will help with tasting,